Welcome back to another episode of Medicare Matters with Mackenzie, your go-to place for clarity, confidence, and dependable guidance through the world of Medicare. I'm your host, Mackenzie Anderson, and today we're talking about something many families face, helping your aging parents make their Medicare decisions. It can be emotional, and it can definitely be confusing, but it doesn't have to be overwhelming. Not when you have the right support in your corner. Because remember, you care, we care, Medicare. So let's get started. Medicare isn't a one and done process. It'd be nice if it was, but plans change every year. Premiums, networks, drug lists, benefits, and most of your parents may assume that nothing has changed because they didn't change anything. Sometimes your parents do assume that, something has changed and it impacts them. But Medicare updates quietly, and those small changes can have big ripple effects. That's why having a trusted agent like me matters. My job is to stay on top of everything, every shift, every adjustment, so you and your family don't miss a beat. So families tell me all the time, Mackenzie, I would have never caught this on my own or something like that. But the thing is that you're not supposed to, and that's what I'm here for. So how do you bridge this conversation with your parents? So talking to your parents about Medicare can feel delicate. They want independence, you want them protected, and sometimes it feels like those two things bump heads. But here's how to make it easier. Let the annual enrollment period be an opener. Say, Mom, the annual enrollment period is here. Want me to have my agent Mackenzie review your plan? This keeps the tone neutral and supportive. Make it a team effort. Say, let's go through it together. Mackenzie can explain things. So I become the neutral third party, not a family member, not an emotional trigger, just the guide. Lastly, set a time and take your time. Medicare isn't something that can be or should be squeezed in between appointments and errands. A calm conversation makes all the difference. So what information do you need to help? When I review plans for your parents, there's only just a few things that I need. If an application is going to be submitted, then we need the Medicare card. I need to know what their current plan is, who their doctors are, medications, dentists, eye doctors, just the regular things, the regular providers that help them meet their health needs and priorities. Once I have that, I can identify mismatches, some cost increases, network issues, or better options your parents may not see. This is typically when families usually say, oh wow, I had no idea that this changed. And that's exactly why having professional guidance matters. Now let's walk through the big decisions I help families make. And why having a local agent, knowledgeable agent is priceless. So there's Medicare Advantage and there's Medigap, but they're not just two different types of plans. They're two totally different approaches to healthcare. So I help families find which one truly fits their needs and not just really, what looks good on paper. Prescription drug plans. Formularies change constantly. They definitely change every year, and sometimes they change in the middle of the year. So you're probably wondering, and these are the questions that you have, and most likely your parents is, well, what if I get prescribed a new medication in the middle of the year and the plan doesn't cover it? Or, are there ways that I can save money on my medications because it's just getting to be too expensive? Because that $10 medication last year may be $60 next year or even more expensive. So what I do is I compare everything. I look at the medications, the dosage, the tier level, preferred pharmacies, shop around for better costs, and all of this to help prevent surprises. Doctors and hospital networks. So I know you and I and your parents have built relationships with doctors, and especially the good ones, we want to continue those. So I make sure that those doctors are still in network and help find a plan that keeps them connected with those doctors. This is where my expertise matters the most, because here's the truth. The Medicare and You book doesn't tell the whole story. It gives the framework, but not the real world details families actually need. Medicare.gov doesn't tell the whole story either. It's a great tool, but it can't warn you about local doctor network quirks, explain carrier reputation, highlight billing patterns, or flag medications that tend to cause coverage problems, because those things are learned through experience, not a website. So for example, with medications, there may be a quantity limit. You can only have 60 pills for 30 days, or there may be prior authorization, or PA, on it. That means that before it can get prescribed, or before you can get more amount of, or so you can get more than a couple of the pills, it would have to be approved by the doctor and the plan. But this is where I make a real difference for families. So I offer local insight into networks and providers, cost-saving strategies for managing, the medications specific to our area, real relationships with carriers. So if billing issues or denials happen, I can step in directly, get on the phone with you, and guidance beyond the surface level, because I work in this every single day. This is the part of the book that the book can't teach, and no website can replicate. Because families don't just need information, you need interpretation, insight, and someone who knows how the system works in real life and not just on paper, and someone who knows how to work that system. So, like I mentioned earlier, Medicare can bring up a lot. It can, with aging, independence, fear of change, worrying about costs. So I sit down with families. A big part of my role is simply just to help you take a deep breath. I explain the things in calm, simple terms, and I give your parents time to ask questions and make sure they feel heard and respected. So you get to stay the caring child, they get to stay in control, and I can handle the complexity and stress. And that's where You Care, We Care, Medicare comes into play, and that's how it looks in action. So when everything goes right, here's what you'll see. Your parents feel understood. Their doctors and medications are covered in network and covered at the least cost to them. The plan fits their real needs. There's no surprise costs in January, and you have the biggest piece of all, which is peace of mind, knowing that you didn't miss anything. And best of all, you have an agent like me who supports you year-round, not just during enrollment. I want my clients to reach out to me. I want them to email me, call me, text me. You can text me at 512-599-9527, but I want them to come to me before they go to the carrier if they're having any of those issues, because maybe most often I have the answer to their question, and when you get on the phone with the customer service representative, which they do absolutely amazing jobs, and I love them dearly for that, but they may have to go and search and find the information. Sometimes, a lot of the times I have it right there. And, if you're having issue with a provider in billing, then we can say, all right, well, let's look, send me the statement. Let me go over it with you, right? Let's see if they didn't bill the insurance, if they, if there's any sort of error. So if you want to make sure that your parents have the right Medicare plan with local insight, real guidance and support that goes far beyond any handbook or website, I'm here for you. So reach out anytime, ask questions, ask the hard questions. I pride myself on being honest and very open with information there. Reach out anytime, ask questions. I want you to ask me the hard questions. I don't shy away from those. So I pride myself on being honest, maybe honest to a fault, but I pride myself on that and a big part of my ethics, because You Care, We Care, and Medicare. So thanks for listening to Medicare Matters with Mackenzie. I'm Mackenzie Anderson, and I'll talk to you next time. Thanks for listening to another episode of the Medicare Matters podcast with Mackenzie. Please make sure to subscribe wherever you get your podcasts so you don't miss an episode. Please also leave a review, as that helps me reach more people that can benefit from this podcast content. If you have questions or topics that you want me to cover for a future episode, please email them to Mackenzie@premiermedicaresolutions.com.